Good morning, everyone. Ani, welcome. My name is Alan Moffat. I'm the CEO of Maamwesying, the North Shore Tribal Council, and I'm honored to be here today on behalf of our organization. Before we begin, I would like to respectfully acknowledge that we are gathered on the traditional territory of the Anishinaabe peoples, including the Ojibwe, Odawa, and Potawatomi nations. This land is part of the Robinson-Huron Treaty of 1850 and has been cared for by Indigenous peoples since time immemorial. We recognize and honor their deep connection to this land, the water, and the communities who continue to call this place home. We express our gratitude for the opportunity to live, work, and serve on this territory. At Maamwesying, our work is grounded in a deep commitment to the well-being of the peoples and communities we serve. Every day, our teams show up with dedication and professionalism to meet the needs of individuals and families across the North Shore. We recognize that for many Indigenous people, mainstream systems have not always felt safe, accessible, or responsive. There are real and ongoing concerns about the care people receive, the barriers they face, and the impact of historical and systemic inequities. These experiences inform our approach and strengthen our responsibility to earn trust through consistent, respectful, and culturally grounded care. In a healthcare system under strain, where resources are limited and needs continue to grow, Maamwesying remains focused on listening to community voices, advocating for equity, and improving access to services that reflect dignity and understanding. Our teams bring together clinical expertise and cultural knowledge, blending professional standards with community-based values. This allows us to provide care that is both high in quality and rooted in the realities of the people we serve. At the heart of Maamwesying is a clear commitment. Everyone deserves access to care that is respectful, culturally grounded, and responsive to lived experience. We remain dedicated to strengthening systems that reflect these values and to supporting communities in ways that are meaningful and sustainable. As the CEO, I'm continually inspired by the dedication of our staff, partners, and community members. Their commitment reminds me that this work is both a responsibility and a privilege. Miigwech for being here today and for sharing this moment with us. We look forward to continuing to work together.
Miigwech Allen. I would like to now introduce MP Terry Sheehan, Member of Parliament, Sault Ste. Marie, Algoma.
Thank you ever so much, CEO, for the land acknowledgement. I share your respect. Thank you very much. And thank you to everyone for being here. In particular, I see Chief Karen Bell from Garden River First Nation. Thank you for being here today. It's a good day today. And thank you all for joining us. My name is Terry Sheehan, and I am the Member of Parliament for Sault Ste. Marie, Algoma, the new riding. And it's a pleasure to be here. In particular, today's announcements not only cover Sault Ste. Marie, but parts of my new riding in all of Northern Ontario. You know, Maamwesying North Shore Community Health Services, you've done a wonderful job in converting the former Ontario Works building. It looks great. I see the staff here, wonderful. It's, a really welcoming place. And, I know you do good work here. Not only am I the Member of Parliament, but I'm also chair of the standing committee, a very important standing committee called Indigenous and Northern Affairs. And we take on a lot of work for Parliament. It's all the parties when we sit in a committee, and sometimes we do, our own studies, but a lot of times it's stuff that comes from Parliament to us that we review and make recommendations to make better legislation. So it's a double honor to be here today, right here. And so, the one thing that I wanted to say is that, this place is a hub for the North Shore and Sault Ste. Marie, and I know that you serve all the different sorts of places as well, including places in Northern Algoma as well. And, I want to thank you again for being the great role that you play in everything you do, from offering primary health care, supporting mental wellness, and providing home and community health services. As part of that work, you are on the front lines of the illegal drug crisis. As healthcare providers, you have seen firsthand the devastating effects of substance use in individuals, families, and the surrounding communities. This is a heavy burden that nobody should carry alone. The Government of Canada recognizes that the illegal drug crisis is one of the most serious public health challenges in our country. And it's not just limited to our country, it's around the world. But it's just not in the big cities. It's in rural Canada. It's in Northern Ontario, to a great degree. And that's why today is a very important announcement, because years ago, we didn't have many services. We didn't have as much services as perhaps the larger centers did. And that's why the federal government came up with the Emergency Treatment Fund to go directly to the communities in rural Canada, in Northern Ontario, in Indigenous communities and non-Indigenous communities, so that we could fund these important initiatives that's going to combat this. And that's from the grassroots up. That's from listening to you and to your communities on what you think is important, rooted in culture, in tradition, and, making sure that we continue to work with you. So one of the things that I am pleased to announce today on behalf of the Honorable Maamwesying, Minister of Health, that I'm announcing that we are providing more than $11 million for 8 projects to address the illegal drug crisis in Northern Ontario. So that's $11 million for 8 projects throughout Northern Ontario in Indigenous and non-Indigenous communities. These projects are delivering a wide range of health and social supports for people who use substances, including community outreach and system navigation, connections to treatment, and land-based healing. As part of this commitment, our host, Maamwesying North Shore Community Health Services, is receiving more than $3.6 million to address substance use in urban Sault Ste. And along the North Shore, around Lake Huron and Lake George, Georgian Bay. So all along there. So thank you ever so much for stepping up for this, and give yourself a round of applause. Through this project, the center will break down barriers that prevent people from First Nations communities, Métis, and urban Indigenous communities, from so that they can get the care that they deserve. This includes connecting participants with people with lived experiences who will help support them through their recovery, both physically and spiritually. This initiative will also provide culturally appropriate support through a crisis counseling team. The funding I am announcing today is being provided through Health Canada's Emergency Treatment Fund, which helps respond to emerging critical needs related to the illegal drug crisis affecting municipalities and First Nations, Inuit and Métis communities, organizations, like the one right here. You have the insight to identify what will work and the wisdom to know what will not work. The Government of Canada is working with organizations like yours to make a difference for people impacted by substance use, their families and surrounding communities, both here in the Soo and all across Canada and Northern Ontario. Together with community expertise, government support, we can save lives. I look forward to our continued partnership. What you're doing here is excellent. I feel that, we'll be able to share successes amongst communities across this country through this funding. As many of you may recall, part of the funding that we're announcing today, I had earlier announced the Sault Ste. Marie funding for the community outreach, which was the wellness bus that we're receiving, and that was $3.5 million. So I'm proud to say that in Sault Ste. Marie, Algoma, we have over $7.1 million that the federal government is investing, in fighting the addictions, the opioids, and helping with mental health. So again, chi miigwech to everyone. Thank you very much. For those of you that would like to know about the other great projects that we are announcing today, the background will be released on the wire, but Allison from my office will also have a copy of the other great projects that are going all across Northern Ontario. So again, chi miigwech. Thank you very much.
Miigwech MP Terry Sheehan. We would like to now call upon Chantel Evans, our Director of Mental Health for Maamwesying North Shore Community Health Services, to say a few words.
Good morning, everybody. Thank you for being here with us today. Please excuse my voice. Chantel Evans, I am the Director of Mental Health and Addictions for Maamwesying North Shore Community Health Services. And this announcement this morning reflects an important step forward in how we support people who are on their healing journeys within our communities. For many, our programs are the first point of support they trust. Through the Emergency Treatment Fund support, we are strengthening both our client connection model and our outreach programs so that care remains consistent, relational, and grounded in compassion. This support matters because it allows us to sustain and strengthen mental wellness and addiction services across the North Shore. Through the Emergency Treatment Fund, we can respond to growing needs, maintain continuity of care, and remain present during the most vulnerable moments in a person's healing journey. This funding helps reduce gaps in care and ensures the support is accessible, culturally safe, and available when it is most needed. Healing happens through connection. Our minnow client connection focuses on creating regular and meaningful touch points between clients and care teams throughout the treatment and recovery process. These ongoing relationships help people feel seen, supported, and accountable. They also allow us to identify challenges early and respond with care before situations become crises. When people feel connected, they are more likely to stay engaged and experience positive outcomes. Our outreach programming extends this work by bringing care directly into communities. Rather than expecting people to navigate barriers or long travel distances, our team is going to meet individuals where they are and walk alongside them at their own pace. Outreach creates trust, opens doors to support earlier, and helps individuals and families move forward toward wellness in ways that feel safe and accessible. Central to this work are the cultural pathways that honor our identity, belonging, and traditional ways of healing. By integrating cultural supports, opportunities for connection to elders and knowledge keepers, land-based activities, and culturally grounded practices, we help create spaces where people can reconnect with themselves and their communities while pursuing recovery. Our model combines clinical care, outreach support, and cultural guidance so that healing is holistic and person-centered. This balance allows individuals to access evidence-informed care while remaining connected to culture, community, and a sense of purpose. Ultimately, this work is about ensuring that no one falls through the cracks. We are building a system that responds earlier, stays connected longer, and honors each person's journey toward Maamwesying, living the good and balanced life. Our vision is rooted in Anishinaabe teachings that remind us healing happens through relationship, community, and balance, and that our role is to walk beside our relatives as they reclaim wellness in their own way and on their own time. Miigwech to our staff, partners, and community partners for their dedication and for walking this path with us.